Hi, everyone. Welcome to another episode of 10 Minutes with JPIDS. I'm your editor-in-chief, Ravi Jhaveri, and I'm really very excited to have Dr. Michael Prodanuk, hope I'm pronouncing that right or close to right, who's at the Hospital for Sick Children in Toronto. He was the lead author on one of the papers we published in our July issue of JPIDS, looking at mortality from COVID-19 for children and some of the risk factors. So Michael, thanks for joining us.
Happy to be here. Yeah, thank you to yourself, Ravi, and to JPIDS for having us.
Yeah, it's our pleasure, and a happy belated Canadian Thanksgiving. I know that was just the other day, so I was watching the Blue Jays and Mariners game. We won't talk about the results. Apologies for that. But um, anyway, our listeners know that I start the podcast with the same question for everyone, which is that I'm a superhero nerd, and every superhero has their origin story. So I was just curious if you would share sort of your origin story, how you got involved in infectious disease and infectious disease research.
Yes, absolutely. I definitely won't pretend to be a superhero, but my origins and ID really came from clinical experiences. Going back to when I was a medical student, I did this great summer research project where I had a chance to work in northern Canada, a study looking at children who were being transferred from a small nursing station to tertiary care for acute illnesses. And what really struck me in that time was how many of these children were being transported for acute infectious diseases and the impact it had on them and their families in terms of having to travel many, many hours away. And then sort of fast forwarding to other experiences I had in residency, in pediatrics residency, I was really fortunate to rotate through ID very early on. And one of the experiences that really stuck out to me was actually in our tuberculosis clinic. So I really got to see there how the social factors put someone at risk for developing illness. And it was just very rewarding to see many of those children on treatment getting better. So it was sort of accumulation of all of these clinical experiences and ID that show me how, that we really could make a difference here.
Yeah,
And sort of since then, I've never looked back.
awesome. Thank you for sharing that. I think, obviously, I think there's so much of what you said that really resonates with all of us in the field. Um, so first, your paper describes this Canadian and Caribbean collaboration as the main means to follow and collect data on all these patients. Can you share a little bit about how that collaboration started?
Yeah, sure, sure. So when we set out designing this study, we wanted to be able to generalize our conclusions beyond our high resource setting in Canada. And we also anticipated a relatively low number of COVID-19 related deaths in Canada. So we wanted to include the experience from another region to ensure we had meaningful results to share. So the Caribbean region became a natural choice for us, as we have many colleagues practicing there. There are certainly a number of Caribbean pediatricians and infectious disease physicians who actually trained in Canada, and
Hmm.
particularly at our center at SickKids, and then returned to their home countries to practice. So we were really able to leverage those pre-existing relationships and build this meaningful multi-center study that included Caribbean sites alongside Canadian children's hospitals. And I just wanted to point out that the centers that we enrolled patients from were actually part of a collaborative research network called PICNIC. So PICNIC is the Pediatric Investigators Collaborative Network on infections in Canada, and this is really Canada's pediatric
Hmm.
ID research network. So it was this nice collaboration between some of our Caribbean partners and multiple Canadian sites that made this happen.
Yeah, thanks for sharing that. I think that's important. Certainly, we appreciate all the great papers we get from our picnic colleagues in Canada. So, um, can you talk a little bit about how you're using the data that all of you generated in this paper to talk with um, patients and families and maybe even providers in primary care about COVID-19 and vaccination?
Absolutely. So maybe I'll sort of just briefly go over the research question we had in our results, and then we can get
Sure.
into how that translates into communicating with patients and with others. So
Yeah, please.
really, we wanted to ask the question is when children unfortunately do die of COVID-19, what underlying factors might predict their death? And so we wanted to use that information to identify children who are at risk of the most severe outcomes with COVID-19, and ultimately to inform prevention and management strategies. So what we did is we undertook a retrospective case control studies. This is at 10 different sites across Canada and the Caribbean. And we wanted to assess these underlying comorbidities that may be predictors of mortality. So across the 10 sites, over about a 2.5 year period, we did identify 26 COVID-19 attributable deaths. And we matched those children 1 to 3 with children hospitalized with COVID-19 who ultimately survived to discharge. So with our analysis, what we did was a logistic regression, a univariate models, and we identified several factors that were actually associated with a significantly increased odds of death. And so those were 4 factors. And I think they're not necessarily surprising to a lot of us that practice in this space. So they were medical technology dependence. So that includes children that have a chronic need for devices such as tracheostomy or enterostomy tubes, and then as well as a couple other conditions, so neurological conditions, genetic disorders, and children with developmental behavioral conditions. And we sort of compared this to pre-existing data from our setting as well. So there have been some pre-existing data from the Canadian Pediatric Surveillance Program, and they did a multi-center study that found that children that were dependent on medical technologies and then those with neurological conditions and genetic disorders were also at significantly elevated risk of severe COVID-19. So COVID-19 requiring ICU admission or
Hmm.
intubation.
Hmm.
And so those are really the core of our results. And so we think sort of in our interpretation of that is that our data sort of help reinforce this messaging around which children should be highest priority for prevention strategies. So it's really a suite of interventions, including vaccination, infection control measures like masking, hand hygiene, as well as access to testing and early treatment when those are indicated. So we really feel that these results can be translated both in our day-to-day patient interactions as well as more on a population public health level. So I think when a patient or family are in front of you, this data could potentially be used to help counsel them on what prevention strategies might make most sense for their individual child based on their individual risk factors and what to do if a child is sick, what sort of care they should reach out for. And then on a population level, there potentially are some policy indications around public health and immunization.
Thanks for the summary and then for talking about the next step. So, when I first saw your paper and when I saw the results, I was here at Lurie, similar to I'm sure it's at Kids, we have a large technology group of patients who are technology dependent. We have a specific program called Complex Care who sort of focus on these patients. And it seems to me that your data is like a call to action that we really need to think about a goal of widespread vaccination, if not 100% vaccination, not only for the patients, but perhaps for the family members and other caretakers as well. Are you doing something similar, like on a program basis, whether it's for those patients or highly related patients?
Yeah, absolutely. That's a great point and great question. I think in general, we have these priority populations like complex care programs, which we also have a well-established program at Sick Kids and identifying people that are at highest risk of those severe outcomes. And I think our study sort of adds to that. And so at Sick Kids, we are looking at vaccine coverage in our group sort of broadly at all sort of routine recommended vaccinations, which of course include COVID-19 and influenza vaccinations. I can just comment sort of on the Canadian experience more broadly as well.
Yeah,
So we know
please.
that vaccine coverage across the board in Canadian children has been suboptimal in recent years, and I think unfortunately that has been an issue in other jurisdictions as well. And we certainly have had stories in the media hearing about that there's particularly low uptake of COVID-19 vaccines among children.
Hmm.
And I think high risk groups, such as children who may be cared for in a complex care program, are no exception to that. And despite them being a group who could potentially benefit the most from prevention strategies like vaccines and others. So I don't necessarily have specifics to share right now about what our program is doing, but we are looking at it, and we certainly see that group as a really high priority group for preventing respiratory illnesses.
Yeah, well, I think that would be great. And perhaps then there's an opportunity for some US Canadian collaboration around some guidance
Absolutely.
or at least strong advocacy for these patients to try to get them vaccinated. We also, as I'm sure you're aware, have much lower than we would like vaccination rates. And so it seems like this should be an easy rallying point for people, and then maybe we can bridge to other populations.
I would
Michael,
agree.
is there any other comment or point you'd like to make for our readers before we close?
Yeah, I think just to drive home the point that thankfully COVID-19 associated death is uncommon in children as a whole population, but it really is important to drill down a bit more and understand which children are at high risk of severe outcomes like being admitted to an ICU or in rare cases dying, and really understanding those risk factors and targeting those children for interventions because those are the children we saw most affected during the last few years in the pandemic.
All right. Well, I think that's a great point to end on. Michael, I want to thank you so much for joining us. Congratulations again on the work and the project, and thanks for submitting it to and publishing it with us at JPIDS. And then I just want to say to our listeners, thanks for joining us, and we'll see you on the next edition of 10 Minutes with JPIDS.